So Joe, now that the letter of intent is signed, we've been getting a lot of feedback internally and externally in response to the announcement of the letter of intent. Is there anything that you've heard internally in your organization or externally that kind of surprised you?
I just didn't expect so much overwhelmingly positive and enthusiastic response. With all the mergers and acquisitions going on in the state as well as the country, I just thought that the response would be more muted. Mm-hmm. Internally, I was surprised by the lack of surprise that our internal stakeholders had. They would just look at me and said, well, yeah, we thought this was the logical next step because we've worked together for so long. And so all the things that I thought were going to happen and that they were going to be fearful, they actually felt more relaxed because they were fearful, actually, that we were looking outside the state. Yeah. And they were happy to learn that this was going to be a New Hampshire solution.
Right. You know, it's interesting. In our organization, the first response was, finally. Like, thank you. You know, we're finally moving forward with a relationship that I think people feel is been a long time coming. Right. And we probably talked about it and talked around it. And they're thrilled for that. I think every institution, though, then says, what does it mean for me? Right. What does it mean for us? And it's really been great to actually talk about the fact that we'll probably have a hub and hub model, that we have 2 hubs, and a hub in Lebanon and a hub in Manchester. And they have different market demands, and they'll have different growth opportunities, but it's not an uncommon model as health systems actually come together.
And that's exactly what I tell the folks at GraniteOne, is that this will represent more options for everyone. Patients, employees, physicians, administrators.
Yeah, I agree.